cases or?
What part did home health play in the 90s?
Yeah, it's a great question. Because home health was kind of my thing I was doing. Because it was cost-based. The government, when they went to DRG, they gave cost-based units to hospitals and the community as an outlet. So you're forcing 3-day length of stay with the DRG, right? Acute phase. But now where are we going? We're going to go to rehab. We're going to go. All these were created. So I was in the rehab, geropsych, SNU, and home health space, and my operations stuff was. And so home health played at first it was a game. It was get them out of the hospital and supply. You do one nursing visit every 6 in Medicare, every 60 days, and every day send the home health aide into the house. So it was a form of long-term care, basically. And eventually they got off, but there was not a lot of incentive for them to get off. Home health companies created these huge home health companies. Some of them still exist in that world. They then went from that to prospective pay, like everybody else, in the early 90s. And they said, okay, we're only going to give you so much money, but they didn't designate the amount of care. Come Obamacare, you had the split between the private Medicare Advantage and the traditional Medicare. Today, under the one I was doing in Miami, if you were Medicare Advantage, typically in home health, you'd get 2 or 3 visits. That'd be it. In traditional Medicare, you'd get 20 to 30 visits. So that's where they were making their money. That's where they were, their 15%, they were denying some care down on the bottom side. Theoretically, you would say, why would they do that? Because you'd have them come back in the hospital, spend more money circulating them back. You get penalized for readmissions,
Right.
or ER visits. You get part of your reimbursement taken away. So
You got paid for the DRG, so if you get him out of the hospital and go from paying this amount in the hospital to this amount in home care, you can get more money.
right. Well, and the hospitals were
No
becoming
idea what you're talking about.
engines of community. I mean, these not-for-profits had way more employees than that's what you see today being wrung out of the system, is that and when I was at PSA, I dealt with social workers everywhere, every state we were in, because they were the ones that were managing the care of these children. And the average social worker in those days, this was I worked for PSA from 2001 to 2009. Okay, so 7 or 8 years there. An average social worker made about $60,000 a year. Obamacare comes in place, they're now making $200,000. Same.
Wow.
And so you saw this escalation of money flowing into these people.
There's an incentive for them to do it the way that they want them to do it.
Right. Oh yeah, huge. And that's what you see being wrung. They're morally incensed. These people you saw on the news last night, morally incensed that their gravy train's been taken away.
Oh, yeah.
Well,
Say that again?
my question is, why would we promote a system